Yeah, Adithya join aita annadu.
Sir, mute yourself, sir. Mute yourself.
Yeah. So hi everyone. I think it was around 2 months back when we started off to discuss almost a very similar session where we tried to prepare a roadmap for upcoming 4 or 5 months. At that point, obviously, the major difference was we didn't know when the NEET-SS was, so we were expecting it to be something like in December. But obviously, like always, NBE has sprung a surprise, saying that it's in the early November. November 7th, 8th is when the NEET-SS exam is. And then there's also this INI-SS date that usually is given on the calendar of AIMS. That is on the 22nd of November. This might change. This might change a few weeks here and there. But usually it's followed up. Like it's given at the start of the year and then they try to follow it most of the times. So firstly, first and foremost, the reality check is that the time is not much. It's only like it's already mid-September. It's around 6 to 7 weeks to NEET-SS, including Diwali and all. Maybe it's just around 6 weeks to NEET-SS and 2 months to INSS. It's a very tight timeline. And like I've been in that place where we kind of lose the understanding of the reality of time, and we keep reading one topic for prolonged, like maybe 4 or 5 days, 1 week, one unit or specialty. So it's not time for that. It's time for very high yield prep, targeted reading, targeted practice of MCQs, and obviously smart revision. So that is what we are here to kind of double down and tell it repeatedly. Aditya, through his guidance for students across age groups and exam preparation, says his kind of golden guidance that kam padho or bar padho. I think this is the perfect time for that, needless to say. And that is what we are here to double.
These it looks very simple, come pado bar pado, to be very honest. But I'm sorry, I'm a little unwell right now. I'm having a little bit of laryngitis. So come pado bar pado in a sense is nothing but Pareto principle, right? 80% of your paper is going to come from 20% of the topics. All right. How do you identify those topics? By going through the past 3-4 year papers. All right. That's simply about it. So NEET-SS has undergone major changes. But even if you look at NEET-SS of the past 3-4 year papers, there are records on our channel, right? There are records in the app as well. Just go through those records. Those same topics are repeated again and again. If let's say, for example, if I focus only on hematology oncology, you don't need to go in depth in CNS tumors or maybe rhabdomyosarcoma or something like that. What you just need to know is they keep on asking about Down syndrome and leukemia. What happens in Down and leukemia? They keep on asking about, that's what that question is repeated again and again. They keep on asking just the most common tumors across age groups. That's what they love to ask, right? They love to ask about the Wilms tumor and the conditions predisposing to Wilms tumor. That's a question which is not just asked in NEET-SS, it's asked in NEET-PG as well. So anything that you felt that NEET-PG has important, it's important, automatically important for NEET-SS as well, right? In fact, if anyone does their NEET-PG notes also, they will still score at least 50% in their NEET-SS exam. Maybe that is not enough to get a seat, but it's still, you can at least have a confidence booster if you feel like kya padna hai. Even if you do your NEET-PG notes of your any platform that you used 5-4 years ago, doesn't matter, talk, any platform. If you just do those NEET-PG notes also, still you'll get at least 50% correct. All right. Of course, that is not enough to get the seat, but at least will give you a good confidence. But what I'm basically trying to tell you is the Kampado Bar Pado, the Pareto principle, that the most important topics, they will make up a bulk of your paper. So what is important at this point of time is, like Vishnu rightly pointed out, high yield revision. This should be your goal. Your goal in the next 60, it's not even 60 days to be very honest. 45 plus 7 is 52 days, right? It's your goal should be very simple. 2 revisions, roundabout 2 revisions of high yield topics, plain and simple.
Yeah, so like the timeline is one thing that you should straight away go get that reality check. And the next thing is, like, I think obviously most of you would know the differences, but just kind of quickly summarizing NEET-SS and INI-SS differences, especially who's just maybe an MD pass out, he has to understand that INI-SS is subspecialty specific, while NEET-SS, as Adithya said, it's NEET PG plus, like it's maybe not one level, maybe 2 levels ahead of it, but yeah, it's essentially the base is NEET PG information on which you build up. Also, one pattern which changed last time was the blocks. There were 3 blocks, 50 questions each in NEET-SS. So that we are not really sure if that they'll repeat that. Let's wait for the prospectus, but yeah, just keep an eye out for that, especially if you're doing GTs, etc. You can maybe do your GTs in blocks to kind of mimic your main exam. Cutoffs, as he said, 80% of any work is done in 20% effort, and that extra 20% kind of work needs another 80% effort. So cutoffs, you don't need that 100%. Obviously you don't, it's not like you just read NEET PG level stuff and go, but 80% most of the time, that is 124 correct. So 124 out of 125 is basically 80%, right? Approximately. So 124, yeah. So 122 or 120, something like 80. 120 is 80%. So just around about that, if you get 80%, obviously you'll have silly mistakes, etc. But you're getting a top 5 rank at that. Usually even for the best seats, neonatology, etc., you need a top 10 rank. If you just need neonatology anywhere, it's around top 100 rank. Unless you're very much specific, top 20 rank gives you almost everything, right? So don't go and read all those subspecialty textbooks that you have, Park's cardiology, and all your like Cabra Sir's textbook for pulmonology. You don't need that. We'll come to what are the main things. It's basically one word, that is Nelson, that is the king. So you don't need to go through everything, but yeah, you have to be good at most of the things. So we'll divide this session into mainly like 2 to 3 kind of sectors. Firstly, the fresh MD pass outs who have just given the exam maybe in August, maybe September, maybe they're just about to give tomorrow. So their main strength would be that they've recently read the textbooks, recently read your marked topics or high yield topics or repeatedly asked topics in your universities, which covers most of the main chunks of things. And also clinical exposure is fresh. So any possible questions that have come from clinical scenarios or anything based on examination, instruments maybe, those are very, very like fresh MDs would give that best. But again, most of you would not have practiced MCQ. So that is something you can focus upon in the next few months. And focus little bit more on the breadth. For example, in your university exams, we focus on one particular management guidelines and we read that 2-3 times. But in your NEET-SS, especially in a topic, for example, infectious disease, they do ask small tidbits of random diseases. So just for a context, I gave this example. Similarly, you try to do the basics of many units rather than going into the depth of one unit. So especially for an MD pass out, this is important to note. Then weekly mocks, mini tests, grand tests, this is something that you should specially focus upon because you have not given your MCQ practice. INISS, I would go on to say, as far as to say that if you are confident, if you want only neonatology, you might take this decision that, okay, this time I won't give NEET-SS. This time I'll only give INISS. Let's see, let's give my best shot for INISS. And maybe next time I'll go for, the safer NEET-SS kind of, safety net, and then also focus upon INISS. You can consider that option because many times people might not even think that way. I'm just giving you that option. But otherwise, give your NEET-SS very well. Have that 2 weeks gap that you have, and there you read only your subspecialty textbook. That is one strategy that you can follow. Then recent pass outs who have passed out, I think the last pass out was very close, which is not usually the case. Usually it's at least 1 year, but this time the pass out batch was, I think, something like March or Feb. So this is another group which have done they're not very far from their MD pass out. So their Nelson reading is good, their clinical exposure is decent, but also they have worked upon and doubled down upon their MCQ practice. They're prepping for SS, they know the pattern and everything. But yeah, there is a risk for plateauing of the curve. When you keep reading, there is a level where your information plateau. So that is there. And also you have to keep focused, right? You have to be focused, and your GT's marks might drop sometimes because that new crop of students will come in, and all of this will be happening. But still keep your focus, and that is one of the challenge. And yeah, keep your focus on revising whatever you have read. If you've made your notes, great, you can keep revising them, and obviously do the PYQs and quick correction. I think PYQs is something that you might kind of ignore. So that is something that you should definitely do. INSS, you can do it after your NEET-SS because obviously you've been preparing for NEET-SS. Prepare well for NEET-SS, complete your general pediatrics prep well, and then you have 2 weeks. That is usually enough, good enough. If you're in the groove, 2 weeks is good enough for most of the subspecialties. And I think Adithya can kind of help me on this particular aspect because he's very insightful with you on using faculty based research articles for helping your INI-SS. So Adithya.
So basically the thing is very simple. For example, depending upon the subspecialty that you're looking at, if it is frankly, if neonatology is your goal, then I'll be very honest. ज़्यादा दिमाग मत लगाओ. AIIMS NICU protocol has to be done like NCRT. AIIMS NICU protocol has to be done like, let's put it this way, that the way we used to do NCRT 12 years back, 9 or 10 years back, AIIMS and NICU protocol is like NCRT. Like pretty much every line, they will twist it and they'll ask question from that. They will stick to AIIMS NICU protocol. Sure, they ask questions from Clarity and a little bit from Volpe and everything, but the truth remains this only, that AIIMS NICU protocols, 80% of your questions will be from there only. And you might think that it is not there. It will be there. It will be hidden somewhere. It will be a small line somewhere here and there, right? In the AIIMS NICU protocol, something here and there. Most of the questions are from AIIMS NICU protocols, right? You need not go into too much to be very honest, into the faculty articles. In fact, most of the articles which you need to do, if you feel like doing, are given. AIIMS NICU protocol has a very important section. Every topic has a section called "What's the evidence?" Right? In that, they have given most of the times they have given a very small chunk of what the evidence is, like the They probably have given not even the abstract, they have just given the result, for example. If you still feel like you want to read those articles, you can read those articles which are already given in the AIIMS-NICU protocol as what's the evidence. I'll give you an example. For example, they have given about the Helix trial. Helix trial, I'm hoping everyone knows. It's a trial which was run in India and Sri Lanka for the use of for the use of therapeutic hypothermia in hypoxic ischemic encephalopathy. It did not show any benefit. In fact, it showed that there is increased mortality in children in newborns as far as LMICs are concerned. Maybe you can read a little bit more. I'm not talking the entire article, but at least maybe you can read the entire abstract, if not anything else. But all this is already, for example, they have given about other trials like neoprom trials, stopping retinopathy of prematurity. They are, so you can read those articles, faculty articles per se. NICU protocols will more or less suffice. But if I come out to other specialties, let's say I come to nephro, I think you can put one extra page. I can just give you the name of the faculties, just go through the articles, past 6 months articles, review articles, right? Like past 6 months, the name of the faculty, just search them on PubMed, past 6 months, review articles, that's more than enough for you, right? For every topic, there will be a review article, you can do that. So let's say, for example, for Pulmo, let's say past 6 months PubMed articles are good enough. That's good enough. For Pulmo, Dr. Professor Kabra and Professor Kanaram Jat, KR Jat. All right, so Pulmo and critical care, if you are preparing for that, Professor Kanaram Jat and Professor SK Kabra. Right, their past 6 months, if you find any review article on any topic, so there's some and Dr. Lodha, Professor Lodha, Professor Rakesh Lodha, I will forget. All right. So you can go on AIMS, you can go on the one, which are the professors there, their professors and everything. I'm just saying out the names around. For example, if you're looking for Nephro, in Nephro, Professor Adithya Sinha, right? Professor Adithya Sinha, Professor Pankaj Hari, you can just look at their articles. If you're looking at going for INI-SS in oncology, for example, then Professor Rachna Seth and Dr. Aditya Gupta is my namesake. Professor Aditya Gupta. You can read his articles. They will have some in the past 6 months to 1 year. They might have some review articles. So review articles are basically articles on one particular topic, 3-4 pages. So they might have reviewed, for example, there is a very good review article by Professor Aditya Gupta on GMML. So you can read, it's a 6-7 page articles, but it covers GMML in depth, and questions of any question, 2-3 questions on GMML come on PZonk, INI-SS, or even in PZonk or PHO and SS. But most of the questions will be from that review article itself, right? So go to the AIMS website, search the professor, past 6 months, any review article. All right, that's about it for some small topics if you do them. For example, for HUS, there was a very good article in the ISPN. Instead of doing HUS from maybe Nelson or even from Professor Bagga's book, you can, he had given the guidelines as far as LMIC is concerned. So that way you can tailor your preparation. One every day, like in 14 days, you will have maybe one review article you can read, and that is going to give you an edge. Apart from that, obviously do the subspecialty book. For NICU, it is NICU protocols. For PICU, it is PICU protocols. And the Professor S.K. Kabra's pediatric pulmonology book. For hematology oncology, we all know it's Lenzowski. For neurology, we all know it is Swiman's, and like that. Basically, that's what all you need to do.
Yeah, so we have a video on INI-SS prep, which we did, I think, 3-4 months back. So you can definitely go.
You can definitely check that. Yeah, you should check that.
So we had, we discussed with each subspecialty what are the books that are usually the standard books that are recommended. So you can definitely check that out. Now, coming to long-term repeaters, I think especially those who have gone into general pediatrics practice, have taken a break of maybe 5 years or more, and now have come into the NEET-SS prep maybe since a year or so. So they would obviously have a good knowledge of your video banks. They would use the video banks for the baseline and Q banks for preparation. But the issue again is a gap between them giving a proper exam, right? So temperament here is something that they might need to work on, give repeated GTs, maybe give a very, environment-based GT where they are going into a library or something at a specific point of time and giving it like a final exam. So that is something that they can do on mock tests and error analysis, because sometimes we keep reading, especially if you have a break and you're repeating. I've myself been on that, kind of journey where you keep repeating, reading the same thing, but don't look at what you might be doing wrong in the exam. Don't look at what is the exact questions that are repeatedly asked. So those things you can focus upon. Obviously, don't chase new content. You already would have had notes or a cube or video bank which you have taken that and you've read that. So don't chase new content at this point. Just repeatedly revise and focus on your mistakes that get done. Right, INS is the same thing, subspecialty notes, or if you've made notes, great. If you've kind of spend time on it, made notes, revise that, or you can use these specialty textbooks, use their summaries and your faculty review articles. So we did that takeaway recently, like when the NEET-SS exam was complete a month or so after that, and we felt that Nelson was king. Nelson was asked, obviously, but again, Nelson is a very vast textbook. You can't do that within 2 months unless you have read it through your MD. So if you have used the videos as the guide, made the notes, revise them. If you haven't, then you try to go retrospective, because you have to do your MCQs and focus upon what is being asked, focus upon where the MCQs come from, and use Nelson as a retrospective guide. Recalls cannot be ignored. Both INSS and NEET-SS recalls are asked in either of the exams. So do check out our PYQ videos. Those are also very, very important. And topics are repeated more rather than direct repeat. So that also helps in your retrospective revision, where you can do the MCQs, the PYQs, and read that topic from Nelson if you haven't read. Yeah, so recently when the last exam we went to our older elites and our QRP and we checked. I think we got a lot of questions, that especially your elites. So we have been doing those elite series. So that is something that you should not miss. So just don't go only to the video bank. Definitely go through the elites, especially if you have little time, especially you want to quickly kickstart your, for instance, pediatric endocrinology preparation. Go to the elites, give those tests, understand where the questions are coming from, and then do retrospective reading or whatever notes you have made. Right, so that is something that you can use. And I think strike rate was excellent in the recent exam, and that's why we can confidently tell you this. So yeah, these are the practice resources for question bank. Questions practice. The question bank is there. The newly rolled out edition is there of the question bank. Grant tests are there. We're doing the elite series. That is the kind of what we call as test and discussion, which we call during our PG prep. So that test and discussion will help you a lot. And obviously the
elite is very important. I would say that grant test, definitely doctoral grant tests are really the king. I mean, last time also the top was everyone who got a really good rank told how good the grant tests were in approximating the exams. So give one grant test every week. But apart from that, since you will be preparing not on you won't be revising the entire syllabus in a week, right? You'll be doing it one week. You will be doing one particular topic or one particular subspecialty. Maybe you'll do endo, maybe you'll do echo or something like that. So culminate it with an elite, because in the elite, the 20 questions that we ask, those 20 questions are picked up from the most important questions, be it INI or NEET-SS. Either they have been asked previously, or they're a twist on that question, or they're important topics. So it will give you, and along with that, obviously, there's going to be a small discussion, a half an hour to 40-minute discussion is always there apart from that, on why the correct answer is the correct answer, why the incorrect are the incorrect answers. Elite, either you can use at start to know the important topics, you can use it at the end when you are done with the particular, So elite, I would say that it gives you a schedule. I would say it definitely gives you a schedule. So Vishnu will tell you the elite schedule. I think some of the elites, obviously 3-4 elites have already been done, but it will definitely give you a schedule. So you use that judiciously. Give one grant test once per week. And right now, the goal for anyone who's in the 60 days, unless you have not read, that's a different scenario altogether. But if you are a recent MD pass out, you would have read the Nelson at this point of time. Or even if you pass out 6 months or 1 month, 9 months prior, your Nelson knowledge is still a little bit fresh. So my simple goal to you is, do not read Nelson, but rather practice Nelson using the QBank and GTs. And if you're reading one topic in depth in 1 week, culminate it to the elite test. That is what's going to get you a rank.
Yeah, and also like grant tests, many of the students are hesitant or might feel that I might not be at that level. I think one thing I can vouch for is the level of our grant tests. So our level is definitely not something that is, beyond NEET-SS, or it's like INI-SS level as being asked in NEET-SS. The best thing that all the previous students and the toppers felt was the level of our exams was moderate, something that doesn't dent your confidence, something that gives you confidence that, okay, I can do this amount of questions, and if I can do this here, I can replicate it in the exam. That is very important, especially during this phase of the last 1 month or so. So definitely give the grant test. In the penultimate month, you can give weekly grand tests, and maybe later you can slowly, space them out, or you might give even every 5 days and then slowly space them out. Yeah, so we also have those mini tests. Mini tests is something that can help you have this block based preparation, because it's 20-25 questions, and similarly in the exam also it's 50 questions. So maybe you can do 2 mini tests in a day together and then take a break and then do the next mini test. Either you use the mini test to have a rapid revision, or as Adithya said, and I also feel that is a little bit more robust kind of preparation, that you use the elites, because you also have the discussion there to make it a schedule, right? So I definitely give the mini test. There's no doubt about that, because it's just around 15 minutes per day or half an hour every 2 days. So definitely give the mini test, and I feel this can keep your consistency going as well. And use the elites for knowing the important topics, and also having a schedule. Sub-specialty textbooks, do not read for your NEET-SS. Obviously, you have those 2 weeks or maybe 3 weeks possibly after your NEET-SS if the date is changed. So then you can obviously read all your subspecialty textbooks of your concerned subspecialty, but it's not required for NEET-SS at this point. So at this point of time, INI-SS, yes. If Nelson is thorough, and that rare case, if you're feeling very confident, then maybe you can look at the flowcharts and high yield tables of maybe something like NICU protocols, etc. But otherwise, it's not required per se. So yeah, that was about that. So I think if anybody has any doubts, you can always contact us in your NEET-SS pediatric group. I think I saw one question asking for pediatric cardiology. What book to follow for NEET-SS? I think Nelson is
enough. Well,
yeah,
INI-SS
Nelson is
you
enough
can read
for
ARC, but
INI-SS. You
for
can
INI-SS,
definitely
yeah.
But for NEET-SS, there's no requirement of Park's cardiology.
You
You can
have to
focus
understand,
on.
even although there was a good representation of cardiology here, if you look at the questions in cardiology, most of them were not that tough questions. For example, there was a question on tricuspid atresia. It's an easy question. They had asked about a cyanotic congenital heart disease, even if you didn't know what kind of murmurs are there. That given left axis deviation, and this is to be honest, this is a neat PG pointer. The only cyanotic congenital heart disease with the left axis deviation, automatically the only thing that should come to your mind is tricuspid atresia, right? Similarly, they had asked questions on tetralogy of Fallot, which could easily be solved simply from the fact that the main problem in tetralogy of Fallot is pulmonary stenosis. That's the genesis of everything else. So the questions were sure, there was a good representation. Cardiology, this was different from previous year papers, so that's why a lot of people did get a little bit of root shock as far as cardiology was concerned. But even in these cardiology questions, the questions were not tough. They were mild. They were easy to moderate in nature, for which you don't need to go in depth as far as Park's cardiology is concerned. And Nelson is more than enough, to be honest. Even I would go on a limb out and say that even Ghaiya has covered pediatric cardiology in a very good depth, to be very honest. Right? That if you feel that Nelson is a little too much for you and you really want to do it, even Ghai might be like, and you haven't done Nelson till now, for example. So then even if you read the 60-70 pages of pediatric cardiology from Ghai also, they will cover your questions. Ghai has given it very well, to be very honest, right? So you might consider it to be a neat UG, you might consider it to be a undergraduate level book, but Ghai over the time actually has become semi postgraduate book. With the every update, it's becoming a little bit more bulkier in nature. So that's what I'll say. You don't need to go to the Park cardiology level in for the cardio questions. Sure, if you're preparing specifically for Pete's cardio for INI-SS, then Parks needs to be done, but otherwise it need not be done. Right? There were not questions. There were no questions which were like, which are basically the a lot of, I feel a lot of people do understand the mechanics of the disease or the hemodynamics of the disease. What they fail and what they have a little bit trouble is related to the treatment and how the surgeries are planned and how they are done. And which is frankly not asked in NEET-SS, to be very honest. All right. Most of the questions do come from the simple pathophysiology, and they don't come from the complex treatment and the surgical maneuvers that you need to do, right? So Nelson, even if again, like I said, I will go out on a limb and say, अगर Nelson भी नहीं हो रही, you can still go just do Ghai also. It will be sufficient. It will at least get you 80% correct, if not 100%.
Yeah, I think I'd like to add that cardiology, the question number was more last time, but the difficulty was not
Was
very
not more,
high.
exactly.
Yeah, it was
Difficulties
pretty
were easy.
much.
It was very doable. Easy to moderate questions were there only.
Yeah. And secondly, a guy is an excellent hack. Me myself have, like something, it's something that very commonly happens. Sometimes you might not find time to read a particular unit from Nelson per se for your MD exam. So I have used Guy a lot of times. I think specifically pediatric cardiology only I read Guy and went for my MD exit and maybe added a few things that were previously asked. So if that is the case, if somebody has left out Nelson, some subspecialty, you can definitely do your Guy well, especially to understand the basic concepts, and then build upon your PYQs, your elites, etc. Using them, you can finish that off, right? So yeah, any doubts, anything, you can always contact us. I think we're pretty much active on our group nowadays with clearing your doubts, posting some concepts here and there. So you can definitely scan our QR code and join our group. So thank you so much. Yeah, meet you on the group.
Thank you, sir.